Troponin is a type of protein in the cells of the heart or muscles. They are released by damaged heart muscle cells or skeletal muscle cells due to an injury. Therefore, cardiac troponins can be called biomarkers of myocardial injury. The troponin test is used to screen people who have chest pain or other symptoms of heart disease, but it can also be used to monitor patients with known heart disease to see how they respond to treatment. There are two types of troponins that are used as diagnostic markers. They are troponin I and troponin T. Both of the troponins have the same significance and caveats. The doctor may advise either troponin I or troponin T but not both. It can be done as a card test or a laboratory test. This is what a card test looks like. Card test is quick and compact. Card test gives results instantaneously. Card test can be done at bedside, clinic or home also. A laboratory test needs to take the blood sample and analyze it afterward in a machine. It takes a few hours but the results are more accurate. This test is mainly done on an emergency basis during the evaluation of chest pain. Trop T or Trop I helps your doctor determine the cause of your chest pain. Two normal troponins can exclude heart attack in most cases. Elevated troponin raises the suspicion of heart attack. Acute MI results from sudden occlusion of a coronary artery with a clot on top of cholesterol plaque. There is a complete shutdown of blood flow to one portion the heart. Therefore, the heart is deprived of oxygen and nutrients. This leads to the death of the heart muscle. Death of heart muscles releases troponin T and troponin I into the bloodstream. The diagnosis of a heart attack requires both evidence of the death of the heart muscle and symptoms or signs of a heart attack. The troponin test checks the blood for markers of myocyte death. ECG test checks for signs of a heart attack. ECG tests and cardiac troponins are the two tests that have immense value in the management of myocardial infarction. However, elevation in troponin levels is not synonymous with diagnosing acute MI. There are several causes for the height of troponins. Acute myocarditis can clinically mimic a heart attack. Inflammation of the heart muscle is called myocarditis. Stress cardiomyopathy patients are also present clinically similarly to myocardial infarction. This is more common in elderly females. ECG test also shows some changes. Troponins are also elevated but only modestly. 2D echo test reveals characteristic findings that are unique to Takotsubo syndrome. CAG, if done, reveals normal coronary arteries. Troponin levels are elevated in various types of heart failure. Elevated concentrations of troponin T and I have been described in patients with atrial fibrillation. Dissection of the aorta, a surgical emergency presents with chest pain. Troponin levels are elevated. Clots in the leg, DVT, occasionally detach from there and lodge in the pulmonary artery. This is called pulmonary embolism. Moderate to severe pulmonary embolism can lead to elevation of cardiac troponins. Elevations are more often modest. They come down to normal within 2 days in contrast to the more prolonged elevation with a heart attack. Serum troponins are elevated even in pulmonary hypertension, a condition where the pressure in the pulmonary arteries rises. Acute exacerbation of COPD can also increase troponin levels. COPD is most often caused by long-standing smoking. Elevated cardiac troponin levels have been described in the setting of acute brain stroke or bleeding in the brain. Patients with certain kidney problems can have elevated troponin levels. Severe burns to the body can cause elevated cardiac troponin levels in the blood. Drugs or toxins that can affect heart muscle rises blood troponin levels. Elevated troponin in patients with or suspected of COVID-19 infection is also very common. To conclude, we recommend a troponin blood test for any person with chest pain or other symptoms of a heart attack. All patients with these symptoms should be tested for troponins immediately after their arrival at the hospital to rule out a heart attack. It is not a test done as a preventive measure or routine health checkup.